Okay, moving on to the large intestine channel. The first of the big points is large intestine 4, and that guy's going to be midway along the shaft of the second metacarpal bone on its dew claw aspect. So we have our lung point here, lung 7, and although we don't have a dew claw here, I can imagine that midpoint along that second metacarpal bone would probably be just around there. The next point is large intestine 11. So if I actually were to bend his elbow and look for the lateral extent of the cubital crease, we'd be around there. So that's where large intestine 11 will be. Large intestine 10 is going to be too soon distal to that. And if I use the soon measurements based on sort of imagined rib width here, I figured it would be probably about, well, about there. And I can check that because I'd want to kind of take midway between these 2 points and then take a third of the distance between these 2 points. So that would take us to about there. And I can check that because it's kind of on the path from large intestine 11 to large intestine 4. Based on this, actually, I think I'm going to move it a little bit more cranial. So that was actually a good way for me to check that. And then the last point is going to be just lateral to the nasal, the alar fold. So because we have a nice crease here, we're just going to follow that out and just go lateral to that point there. And that's our large intestine channel.